All right. Good afternoon, everyone. Again, my name is Lori Christenson. I'm the Gallatin City County Health Officer. And I'll just go over our weekly surveillance report to kick off the conversation. And then I'll turn it over to, we have Kallie and Michael Becker from, well, Kallie is from Bozeman Health, and we have Michael Becker from MSU who's joined our call today. So we'll start with our surveillance report. And as you can see, we are seeing kind of an increase week to week in our daily and 7-day average number of cases of COVID per 100,000. So this was up. Our rolling 7-day average right now is 19 cases per 100,000, and that's an increase from 17.9 cases per 100,000 as of last week's surveillance report. Just as a reminder, this number, if you multiplied it by 7, roughly gives you where we are in terms of that community transmission number. So I'll get to that here in just a second. But as a reminder, when we're talking about community transmission, we're talking about the amount of virus that's circulating in the community and the need for additional mitigation measures such as wearing a mask. So I will get to that here in just a second, but I always want to point that out because it's an average versus the cumulative. Percent positivity, we are, our rolling average of percent positive was 6.5. This is a bit of a decrease from our 8.6 positivity rate. We continue to see additional people getting tested, which is great. So it means that at this point in time, we are certainly not at the level where we're concerned that we may be missing cases or missing a significant amount of cases, but this is a trend we'll keep watching so that we don't hit over this red line for any significant period of time. Moving right along, still good news in terms of turnaround. That median time from specimen collection, so from when someone gets tested to a report to public health, is still 1 day, which we like to see because it really helps us be really effective with our contact tracing efforts. And this is for, again, just 1 dose. We are definitely seeing an uptick in the number of individuals who are interested in receiving vaccinations, which is really good news. We like to see that. Right now, we're sitting about 56% of Gallatin County residents who are fully vaccinated. Moving forward, we're going to transition in our surveillance report to showing our fully vaccinated, and we'll also break it down by age groups for fully vaccinated. The reason being is we're wanting to make sure that people understand and continue to understand the importance of getting that second dose. So just look for that little bit of change here in the weeks ahead. And then back to that transmission, as you know, a couple of weeks back, we recommended, based on our level of community transmission, that whether you're vaccinated or unvaccinated, you should be wearing a mask in indoor public places. So that recommendation applies to both vaccinated and unvaccinated. If you're unvaccinated, one, I'll always say, go ahead and get a vaccine. Now is the time. But secondly, no matter where we are in this transmission level, you should be wearing a mask if you're unvaccinated at this time. And again, we are in our high transmission level for our community in terms of cumulative cases per 100,000 for the last 7 days. So again, just to reiterate, we're recommending that every individual wear a mask in indoor public places. All right, with that, I will turn it over to Kallie to talk about Bozeman Health. Kallie.
Excellent. Thanks so much, Lori. Hello, everyone. For those of you that I don't know, I'm Kallie Kujawa. I'm Bozeman Health Incident Command Lead. I do have an update, a short update for you today. Currently at Deaconess Hospital, we do have 7 hospitalized patients confirmed positive for COVID-19. In the past 4 weeks, when we've looked at the data on those patients, we have seen a wide variety in age ranges. Those age ranges of our hospitalized patients who are confirmed positive for COVID-19 have included pediatric age ranges, those in their 20s, 30s, 40s, 50s, 60s, 70s, and 90s. So I stated it that way just so you could see that we have seen hospitalized COVID positive patients in nearly every single decade of age ranges. Our infection prevention measures remain in place as they have been since this pandemic reached the Gallatin Valley in 2020. We want to reiterate that masks and face coverings, just as Lori mentioned, are absolutely required for entry into any Bozeman healthcare site, and they must be worn for the duration of the visitor or the patient's visit. Right now, our B2 urgent care location is currently experiencing sustained triple volumes of patient visits and patient encounters when we compare those to the volumes of previous years. We are finding that 30% of those patients at our urgent care sites are requesting COVID-19 travel tests. So with the increased demand at that location, we are unfortunately unable to provide travel tests for the remainder of today and throughout the weekend so that we can focus on those patients who require symptomatic testing and symptomatic care. We recommend that individuals seeking a travel test go through an online provider or through Walgreens or through other locations throughout the weekend. We definitely look forward to accommodating travel tests again next week, and we will completely outline the procedure for that once it has been formalized. We appreciate everyone's understanding as we persevere through these increased demands on our health system. At Deaconess Hospital, we do have visitor restrictions in place that are very important to adhere to, and we ask for your partnership in that. Currently, we are allowing up to 2 visitors. And again, those visitors must always have their masks on when they are visiting. This is dependent on the condition and the illness of the patient. There are times when it is unsafe for patients to have visitors, but that will be determined and communicated on a case-by-case basis. We highly discourage visitors under the age of 12, and we recommend in that instance that individuals do video visits or they do phone calls to their loved ones who are hospitalized. Our extremely dedicated nurses, physicians, providers, respiratory therapists, and every single member of our team is giving excellent care. And we continue to need your help and your patience and your understanding as we work to meet the needs of everyone. Please continue to practice infection prevention measures, including washing your hands frequently, covering your nose and mouth when sneezing or coughing, wear a mask in public settings regardless of your vaccine status, stay at home if you don't feel well, and most importantly, if you haven't been vaccinated against COVID-19, please get your vaccine today at any location of your preference. There are many locations still available for administering those vaccines. I believe that's all that I have at this point in time, and then we can talk further if there are questions.
Great, thanks, Kallie. I know we have Michael Becker from MSU. Do you have any updates to share, Michael?
Yes, can everybody hear me all right?
We can, thank you.
Okay, I apologize for not having video. I'm working remotely and my Wi-Fi is spotty. I'm trying to save bandwidth today. I do have a couple of short updates. I can say that MSU's vaccination incentive program for our students continues. We're seeing good response to that. School hasn't started yet. That won't start until August 25th, but we've already seen more than 2,400 entries into that incentive program sweepstakes. So that's good interest in vaccinations. The university continues to strongly urge everyone who visits our campus, students, faculty, staff, and community members, to get vaccinated wherever they can. For our faculty, staff, and students, we continue to offer the vaccine clinic at Bobcat Stadium, which is by appointment through University Health Partners on campus. We also continue to offer symptomatic testing for our students, and we are following mask recommendations set forth by the CDC and in alignment with Gallatin City County. So that's about all I have for an update. And unfortunately, I have to sign off in a minute, so I may not be available for all the questions.
All right, great. Then maybe we'll start, and if anyone online has questions for Michael with MSU, we can start with those. All right.
Thanks, everyone.
Yeah, seeing none. Thank you, Michael, for joining us. Any other questions that we can help try and answer today for all of you?
Hey, Lori, can you hear me?
I can, Annie. How are you?
I am good, and I do apologize. My video's off. I am just visually unappealing right now, so it's better for you guys not to see me. But I had a quick question for you, and I was a couple minutes late, so I do apologize if you already answered this. But is there a way to see when someone tests positive what strain they have, if it's alpha or if it's the Delta strain?
Yeah, that's a good question. So there are sequencing, the Montana Public Health Lab is doing sequencing for variants of concern. So that includes the Delta variant, other variants that have been circulating. And the best way if an individual to understand or to know whether or not they did become infected with a variant is to reach out to their healthcare provider with that information, so that we at the health department don't have, we can't share that information with a particular individual, but it is something that if the healthcare provider, if an interested party is interested in that information, they can reach out to their healthcare provider.
Gotcha. Are you allowed to share, do you have numbers for Gallatin County, or is that not allowed?
Yeah, it's a cumulative number that we have available for Gallatin County, and that's part of the variant report that comes out with DPHHS every week. I can put it in the chat box here in just a minute, or maybe Holly can put it in there for us. One thing to note is that oftentimes it takes more time for that particular lab to be run and sequenced. So there is a delay oftentimes in the reporting of variants. So just kind of keep that in the back of your mind. I think probably the more important thing just to keep in mind is that without a doubt, the Delta variant is the predominant variant, not only in the country, but also in Gallatin County and in Montana. So it is here. So we should take all the precautions that we can to protect ourselves from a variant that is highly transmissible. Kallie, do you want to add anything to that?
No, just to play off of that a little bit, we are sending any concerning specimens to the Montana Public Health Lab for sequencing. So we are actively feeding the Montana Public Health Lab so that they can have the most accurate and up-to-date information in their reports.
Thanks, Kallie.
Thanks, guys.
I'm curious, what makes a specimen concerning when you say that? Is it someone with specific symptoms, or how do you figure out what might be a best specimen to send to a lab?
That's a really good question, and I would probably defer to our molecular biologist if they were on the call right now. But I know that our main lab has a way when they are running specimens on the PCR analyzers to note that something looks like a variant. I don't know exactly the molecular level of that, but they do have a way to identify on our current analyzers that something looks suspicious, and then they do send that on to the public health lab. I don't know, Lori, if you know more info on that, but I don't know the specifics of how they identify the variant on the PCR analyzer.
I also don't know the specifics of that.
But I know that they do, and they can. They just don't know what variant it is until it's sequenced at the state lab level.
Other questions?
Yeah, I've got a question. Hi, I'm Olivia with Yellowstone Public Radio. Yeah, I have a question for Lori and Kallie. I noticed that there's a vaccine clinic that's starting next week in Gallatin County that's specifically for youth entering kindergarten through 12th grade. And I was just wondering kind of or what data is available by age group. I looked on the Gallatin website. It looks like there's vaccination rates by age group, and then there's total number of cases. But I was wondering what other data might be available for that age group, and also if there's hospitalization data for that age group as well.
Thanks, Olivia. So just, I want to make sure I'm going to answer your question correctly, make sure I heard it correctly. You're interested in the percent fully vaccinated by age group for COVID-19 vaccines?
Yes, that's right. For COVID-19, exactly. Yep.
Yeah, if you give me 1 second, I'll actually pull up some metrics we have around that. And just for clarification, so the vaccination, back to school vaccination clinics we're holding next week are really, they're part of a routine childhood immunization. So we're really focusing on those routine immunizations and offering the opportunity for a COVID-19 vaccine for those who are eligible. So I just wanted to clarify that. We believe that all vaccines are important for overall health and wellness of a child and in terms of their overall development as well. So we want to make sure we're offering all of the eligible vaccines for kids. So give me 1 second and I will switch and find that other slide for you real quick. So give me 1 second.
Okay, sounds good.
And then Olivia, did you ask how many patients were COVID positive and hospitalized in that age group?
Yes,
Yeah.
that as well. Mm-hmm.
Yep. So in the past 4 weeks, we have seen 1 patient in that age group hospitalized who was confirmed positive. Now, keep in mind that that hospitalization may not have been specifically related to their COVID diagnosis. It may have been related to something else, like a trauma or something like that, because we are testing our hospitalized patients right now, so that we can assure that our staff are adequately protected when they're caring for all hospitalized patients. So some of those age groups, just keep in mind that their admission may not be directly related to COVID. It may be directly related to something else, but they happen to have COVID upon further testing.
Okay, thanks for that. And then if I were to request just the total number of people that have tested positive in that age group, would I be able to get that information in a separate request?
That I believe is on our website, on the Gallatin City County Health Department dashboard. And I think Kallie could provide that for you.
Okay, thank you.
Okay, so in terms of kiddo or all vaccinations by age group, or vaccinations by age group for fully vaccinated, can you guys see that slide okay? Okay, so this is fully vaccinated Gallatin County residents by age group. So we have 31.4% in the age groups of 12 to 17 and onward as well. You can see that we have the most amount of room for growth in terms of fully vaccinated in our youngest age groups. What I can attribute that to is they haven't had the vaccine for nearly as long as our older age demographics, but we are seeing an increase, and they've seen the most amount of increase in the last few weeks, along with some of these other age groups as well, getting their first dose as well as being fully vaccinated. So hope that helps answer your question, Olivia. Okay.
Yeah, just one more question. I noticed you have, I thank you for pointing that out. Is there specific data by age group in terms of the positivity rate or the number of people that are testing positive for COVID at this time?
Yes, that is on our Healthy Gallatin dashboard on healthygallatin.org. We have a dashboard that shows the number of cases and we can break it down by age group.
Okay, awesome. Thank you.
And I think Holly can point you in that direction as well. And she just did in the chat. All right, other questions?
I had a couple other questions. A question for Kallie. You mentioned you were talking about the hospitalizations over the last 4 weeks and the demographics. I was curious if you had a number of how many people were hospitalized in that last month. And then I think you just told Olivia it was just 1 kid that was COVID positive.
Yes, yep, there was one pediatric patient. So under the, we're just going to call that under the age of, or 18 and under. So we had one of those. I'm just trying to do the math in my head really quickly. I can tell you by age range how many are in each of the decades, and then I can add those up in just a moment. So we had 2 in their 20s, 3 in their 30s, 4 in their 40s, and 6 in their 50s. I feel like Dr. Seuss right now. We had 3 in their 60s, and we had 5 in their 70s. Let's see, new updated info. We have 7 in their 80s, and then 1 in their 90s. And that's all in addition to that one pediatric patient that was hospitalized. So my graph isn't telling me totals right now, but I could add that up in just one moment.
Okay. And then I had a question, Lori. I was curious if, because I know this was halted in, I think, June, but if Gallatin County is going to start monitoring the wastewater again, now that we're seeing more cases.
Yeah, we actually haven't stopped.
Okay.
Yep, all that information is updated on our Healthy Gallatin website. The only location that we've taken a bit of a pause on, and that's just navigating some conversations with the lab and the city of Bozeman, is the city of Bozeman wastewater treatment plant. But all of the other sites at this time have been reporting on a weekly basis, and that's all updated on our website. And just as an FYI, we will be moving to at least 2 community sites. So we're looking at continuing Big Sky and West Yellowstone moving forward. And like I said, mentioning Bozeman as another location where we're going to continue hopefully having wastewater monitored as well.
Sorry, I must have been confused when I looked at the Bozeman one. It hasn't been updated in a while, but I see the other ones have been.
Yeah.
Awesome. Thank you.
Thank you. Other questions?
Hey, Lori, I have another quick question for you. Just going back to when you were talking about the immunization clinic, with your professional background, I know COVID-19 is currently not a vaccination required for children, for students, but do you think in the future it will be required?
That is a great question. And I don't know. I think it will take some additional research, some additional time. Other than that, I don't know if I have a good answer for that at this time. It's a good question.
Thank you.
Any other questions? Okay. Well, thank you everyone for joining our call today. And I hope everyone is staying well and taking care of each other. And we appreciate you guys chiming in and asking questions, and know that we appreciate the work you guys are doing as well. So thank you so much. Have a good rest of your day.